Good afternoon. Thank you to SAGES and the moderators for the opportunity to present our work. So I have the following disclosures, none of which are relevant to our work here. As is stated by others in this forum, bariatric surgery is a growing specialty, with the CDC estimating that by 2030, 42% of the Americans will be obese. That being said, only 230 so operations were performed in 2017. Historically, the bypass was the most commonly performed procedure, but starting in 2013, sleeve gastrectomy has overtaken Roux-en-Y gastric bypass, accounting for 60% of procedures performed. Despite bariatric surgery's effectivity in treating morbid obesity and its associated comorbidities, it does seem to have some deleterious effects on skeletal health. Data has shown that 6 months after Roux-en-Y gastric bypass, there's significant decline in bone mineral density, and early data is suggesting that there's a similar effect after sleeve gastrectomy, but the magnitude and etiology of that effect remains controversial still. The aim of our study was to determine the effect of altered bone metabolism in postmenopausal females 1 year after sleeve gastrectomy and Roux-en-Y gastric bypass based on DEXA imaging. This was a prospective cohort study at our institution. We enrolled 28 patients from between the years of 2013 and 2017. We took preoperative and 1 year postoperative weight, height, and DEXA scan imaging. Patients were included in the study if they were postmenopausal females with a BMI greater than 35 and otherwise eligible and being considered for bariatric surgery. Our exclusion criteria are as listed. I will point out that there was a weight limit of the DEXA machine, which was 295 pounds, which did substantially impede our enrollment. These are the preoperative demographics for our pre-op patients. They had a median BMI of 44, but were otherwise similar between those who were being considered for bypass and sleeve gastrectomy. Postoperatively, patients did well, lost a median weight of 66 pounds, which equated to an 11-point drop in BMI. Patients who underwent Roux-en-Y gastric bypass did have a significantly greater weight loss as compared to those who underwent sleeve gastrectomy. When comparing pre- and postoperative DEXA scan results, we did note a significant decline when considering all patients in total body bone mineral content, as well as spine and right rib bone mineral content. Similarly, for pre- and postoperative bone mineral density results, decreases were seen in the spine and the rib. Looking at the same data in tabular format, you can see, as stated, that total body BMC, right rib, and total spine BMC did reach significant values. There was no significant difference in other regional sites. Looking at bone mineral density, comparing pre- and postoperative values, we did note a significant decrease in the spine and right rib. There was a trend towards significance in the T-score, but this did not reach significance. So the causes of alterations in bone metabolism are likely multifactorial. In our study, we saw a significant decrease in effect in the spine, which is consistent with other work that's been done on this topic. One of the theories as the etiology for that is decreased in mechanical loading on the axial skeleton. However, when we compared bone mineral density between sleeve gastrectomy and Roux-en-Y gastric bypass, we were not able to detect any difference. These may suggest that there's similar bone loss between the two procedures, which would be consistent with other data presented. It suggests, though, that if patients who undergo Roux-en-Y gastric bypass have more weight loss and mechanical forces are the only effect at play, you would expect lesser weight loss in patients undergoing sleeve gastrectomy. And this theory that there's different mechanisms at work is supported by recent literature that shows changes in body composition and bone loss are more correlated after sleeve gastrectomy than they are with Roux-en-Y gastric bypass. We have a number of limitations in our study. This was a short follow-up period of 1 year, so we can't say to what degree these effects are maintained at 3 or 4, 5 years out. We had a relatively small sample size. We did not perform any kind of control. Initially, we had intended to measure serum markers of bone metabolism, but that will be an area of future study, was not included in this analysis. While routinely we do monitor for vitamin and hormonal imbalances, these were, and they are corrected if identified. This wasn't included in our analysis. This was a study which was funded by SAGE's grant, and so I want to say thank you to SAGE's. It was a virtuous effort to extend understanding in this field, but there were a number of lessons we learned going through this process. Number one, the weight limit of the DEXA machine was substantially impeded our ability to enroll patients. Our patients are, most of them are over 300 pounds, and so we had a very narrow window of which patients that could qualify. I think moving forward, if we're going to continue this work using a quantitative CT, which has been shown to be actually more accurate in the higher ranges of BMI than DEXA scan would be, and has a higher weight limit of 500 pounds for the machine, would be how we would proceed. And due to the prolonged enrollment process, our study budget was underestimated, which did not allow us to enroll as many patients as we had hoped initially. So in this small pilot study, postmenopausal women did have a significant effect in BMC and BMD. There was no a significant difference noted between sleeve gastrectomy and Roux-en-Y gastric bypass, but our study may be underpowered to detect a difference if there is one. And we do need to do some further work on determining what the mechanism of action is for each procedure. Thank you.